It affects your mood, your feeling. Yeah. It will also affect ability. They affect the ability to cope with other people. That means relationship-wise, you're going to have problem, isn't it? You're also going to have problem in terms of coping. In terms of coping with demands, ability to cope with the demands of life. So we have said that mental disorders are biologically brain disorders that greatly interfere with the person's thinking, and once this happens, it affects your moods, your feelings, ability to cope with the demands of life, and also to relate with other people. Also, you may have problem with the judgment. Let's say, for example, you misplaced your bracelet, isn't it? But instead of first of all looking for it, you quickly conclude that, you know what, I think it is so and so who stole my bracelet, you know? So it will interfere with the way you're thinking. So in a given year, 43.8 million millions in America are affected by brain disorders. They're affected by brain disorders, about 43.8. 1 in 5, the ratio 1 to 5 Americans suffer from brain disorders.
And why is it much more higher in America than like in our African country, whereby we don't have that much problem of mental disorder?
Per se, we may not say that probably the figures are high than it is probably in Africa. It's only that the exposure, or those people who come out and say, you know, there is this problem. Sometimes when you see people with mental health, we think probably they are those maids, maybe they are bewitched, isn't it? And also, one of the challenges of mental health disorder is that it's not like other diseases that if you're sick, you go to the hospital, the doctors will do blood draw, they'll check your urine and diagnose, isn't it? So it is not easy to diagnose that people have a mental condition. And we tend more to concentrate on the extremes. Okay? So how do you know that maybe a person's mental disorder is getting worse? It's through behavior, isn't it?
Yeah.
So if the behaviors are not extreme, people tend to, you know, and also the issue of stigmatization, the feeling of shame, people don't want to admit that they have the condition, isn't it? But if the behaviors, they are extreme, then people, they will tend to focus on that, concentrate on that. So in a nutshell, what we're saying, Samuel, is that there could also be even double the figures, okay? But it's only that people, the concentration on getting to identify those conditions, it's not there, or it's very minimum.
That's true.
All right? But here they have even an organization that deals with the National Mental Wellness Organization that will say, you know what, we have this population. That means they have concentrated to get to know what is the number of, what is the ratio of the people who have this condition, what is the population that per se that, you know, and they go on and on, and they continue to say that one half of all chronic mental illness begins by the age of 14, and 3/4 by the age of 24. Okay? So about 10.2 million people have co-occurring mental illness. having mental illness. So, and I've said one of the challenge that it is not easy to diagnose somebody with mental disorder. That is number one. Number two, people tend only to concentrate on the extremes, isn't it?
Mm.
The extremity of the behavior. If the behavior is becoming worse, maybe somebody is becoming so agitated, mood swings, extreme. So then we tend to focus on that. So a mental disorder can also be difficult to acknowledge. Many people they wait until the symptoms they are severe, and that's when they will call and say, "Hey, I think I need to see the doctor." So other sicknesses like cancer, diabetes, they can be diagnosed through some tests, isn't it?
Mm.
But these ones, when it comes to mental health, it's not easy to do that. It is important to note that it is not your job as a caregiver to diagnose whether someone has a mental disorder. Okay? It's not your what? I'm saying this because the way you understand more is the way you're going to. How do you feel if somebody tells you that, hey, I think you have a mental problem? You're not a clinician, isn't it? And you take that as an insult, isn't it? So those people that you're taking care of, it is not your job to diagnose. So for a person to be determined that he or she has a mental disorder, it has to be a licensed clinician in a care setting who will diagnose whether somebody has a condition or not. All right. So it's not your job. It's not your job. It's very, very important. Then we can talk about stigma. Okay, stigma. So, and before we talk about stigma, we have also said that symptoms they differ from continuum changes often and are not always visible. A person could have a mental condition, but since the behavior they are not in the outward that everyone can notice, that can become a problem to know somebody has a mental condition. So the healthcare provider does not always witness symptoms, okay, and does not have complete history of the person's illness. Let's say some of these conditions, they are hereditary, isn't it?
Yes.
So, and you don't have complete history of the family background and there is such a condition in the family. So that may also prove like a problem to them. So also the person may not always be fully open, truthful, or even aware what is happening. So a person may have a mental condition, will not tell you the truth where he has such a condition, may not tell the truth, or may not even show the symptoms. So these are some of the challenges. Each person's tolerance of symptoms differentiates. So it depends. There may be more than one disorder present in coexisting condition. Stigma related to mental disorder can greatly influence whether a person will seek treatment. Stigma is defined as a sign of shame. Nobody wants to be told that you have a mental problem, isn't it? So that feeling of shame may hinder you or prevent you from coming out and saying, hey, I think I have a problem, a mental problem. So signs of stigma affects how people treat a person with mental disorder. Evidence that stigma exists can take many forms, such as treating the person with the disorder as a disorder. For example, thinking and talking about the person with schizophrenic or not as a person who is living with schizophrenia, and as family hopes and dreams and abilities. So instead of focusing on the dreams, the abilities of what person can do, then there is the condition of the mental. You're wondering somebody speaking how much he want to accomplish, and yet his condition, he has a mental condition. That can be a form of stigma. Thinking there is something essentially wrong, bad, dangerous, or weak about a person because he has a mental disorder. And like what I'm saying, that sometimes people think that they are bewitched, isn't it? Yeah. Or there is a kind of weakness or something is wrong. So when you think them that way, then that is stigmatization. People, they will hide their symptoms because they don't want to be referred in that or to be seen that way. Using offensive, insulting language, you as the caregiver towards the person with the mental disorder, probably referring the person as lunatic, nuts, crazy K, or psycho, thinking bad parenting causes mental illness. So these are some of the things that we're saying they cause mental disorder. So stigma and caregiving. Stigma can prevent caregivers. So yourself also, as a caregiver, you may feel like, I feel like I don't feel comfortable working with people with mental disorder. And this can also hinder you from providing care. So if you believe some of the misinformation about people with mental disorders, you may be uncomfortable working with them, isn't it? I heard mental people, they always hit people. I don't want to be hit, so that may prevent you from working with them. Also, when you treat the person different from other people with illness, such as cancer or disease, you don't treat them as the clients the same. That can also be a problem. Let the fear of the person's mental disorder stop you from finding new ways to understand and relate to the person. When you have fear that something unexpected can happen, that can also greatly affect how you are treating the person, the client who you are serving who has cancer, diabetes, high blood pressure, dementia. It may greatly affect that. Challenge, question your attitude towards mental disorder. Challenge people around you who reinforce myths and stereotypes and misunderstanding about mental disorder, and be supportive. You're supposed to be supportive to their needs. Okay? Yeah. Any questions so far? So we have those sicknesses that are related to mental health conditions. We have those conditions. So the following mental disorders are outlined in the following, and more information on this can be found. You can refer to National Institutes of Mental Health, and there is a website. So the first condition is called attention deficit hyperactivity disorder, ADHD. So ADHD, this is attention deficit. What do you understand by the word deficit? Attention deficit hyperactivity disorder. So whenever you talk about deficit, that means that something is lacking, isn't it? Yeah, so that is one of those diseases related to the mental health condition. We have anxiety disorder. Do we have anxiety sometimes?
Yeah.
We do, even it's a normal part of life, isn't it?
Yes.
Yeah? Like when you attend a visa interview. And you notice people who are coming out, they are coming out crying, isn't it? Isn't it? Yeah? You notice like 10, and then all of a sudden you hear so and so go to window number 4, isn't it? Yeah? You have a lot of butterflies in your stomach that time. You don't know the outcome. That is anxiety. Anxiety can also come from, let's say for example, you've gone to the hospital, tests have been taken, and you've been told to go and wait, isn't it? Go and wait for the doctor to call you. You're waiting, isn't it? And you feel like your heart is racing. So anxiety disorders, we have autism spectrum disorder. Autism spectrum disorder, we have bipolar disorder, we have borderline personality disorder, borderline BPD, borderline personality disorder. We also have depression, dissociative disorder. We have eating disorders. We have post-traumatic disorder, schizophrenia, schizoaffective disorder. So we have related conditions as anosognosia, duodiagnosis, psychosis, risk of suicide, self-harm, and sleep disorder, and substance abuse. All right? So let us first of all look at attention deficit disorder. Attention deficit hyperactivity disorder. Symptoms of attention deficit hyperactivity disorder include being distracted. To be distracted, let's say, for example, you are eating and suddenly you hear the police car siren, you leave food and you go outside, you go to the street. You forget even you're eating. That is a distraction, isn't it? Or let's say you are in the dining room eating, and then you hear people shouting and clapping in another living room watching the TV. You forget food and then you go and join them, isn't it? That is distraction. Bored with task quickly, difficult focusing attention, or completing a single task. Those are some of the things that affect people with attention deficit hyperactivity disorder. Trouble not listening or paying attention when spoken, daydreaming or wandering thoughts, okay, with lack of motivation, difficult processing information quickly, hyperactivity, forgetting, screaming, trouble sitting still, non-stop talking. These are some of the signs of this condition. Touching or playing with everything, difficult doing quiet tasks or activities. Okay, impulsivity, there is impatience, acting without regard for consequences. That can be very dangerous, isn't it? That you can just cross the road without just thinking that, hey, suppose I'm hit by the car, isn't it? You've seen those, it's what we call jaywalking. You're not supposed to cross the road just anywhere, because there are those places that are set aside where you're supposed to, the close walk, isn't it? So you suppose, it depends whether you're following, you're not able to do that. Difficult taking turns, waiting or sharing, interrupting others. These are some of the symptoms. What are the causes? Genetics may cause high risk of developing ADHD, which runs into family, traits, and specific brain areas that contribute to attention. Because remember, the brain has parts, isn't it? So if one area of the brain is affected, then the specific tasks that are supposed to be done by that particular part of the brain that is malfunctioning, then there is a problem. All right? So environmental factors such as cigarette smoking, alcohol use, okay, during pregnancy, exposure to read. A child may lead to increased likelihood of ADHD according to the studies. What are the treatment of ADHD? Treatment are more effective when tailored to an individual needs. That means every individual has a certain way of how that condition may be treated. The other one is behavioral therapy. Okay, elimination of diets to determine whether there are food allergies that also affect that kind of behavior. Also medication, neurofeedback, okay, or biofeedback, and also there are some nutrition supplements that can also help with that. Right? Any questions so far? All right. So we're gonna post there and just have a video and see how more we can deal with this.